through some of the Government of Alberta COVID-19 statistics. Links will be in the description. So when we go to the page here, COVID-19 Alberta statistics, if we scroll down, there will be a bunch of boxes here. If we go under total deaths, where it says 1,193, you click that. It'll bring you to the severe outcomes section. Under the summary, average age for COVID cases that died is 82 years old. Now, please remember, that may not be that they died because of COVID. They may have died with COVID due to other comorbidities. Average age for COVID cases hospitalized with an ICU stay is 59 years. Average age for COVID cases hospitalized is 63 years. Again, hospitalized doesn't mean you were in the ICU, it just means you went to the hospital. Average age for COVID cases not hospitalized is 37 years of age. Now let's scroll down a bit. You'll see a couple of charts here. But what I'm going to focus on right here quickly for just the facts is under the ICU and the deaths columns. Now note where they say case rate, if you go down here it says case rate per 100 cases. So essentially in the case rate column, this will be a percentage because it's out of 100. So total case rate is 1.1%. That means there is a 98.9% survival rate. Now I want to just focus in a bit here. Let's check this out. Under deaths, from under 1 year all the way up to 39 years old, there is not a statistically significant number that they can put there. So it's basically zero. 0 deaths per 100 means 0 deaths per 1,000 until you reach that large enough number where it becomes statistically significant, where they can put a number in to the right of the decimal. Now, further to that, between the ages of under 1 year, basically birth, to 39 is 0 deaths case rate. Okay, 40 to 49 years is 0.1 case rate. That means that is 1/10 of 1% is the death rate. Okay, that's 0.1%. Now think about the previous ones here that were 0. They can't even get a number close enough to round it up to 0.1 to put it there. So that could be 0.05, 0.04, 0.06. Maybe they don't even round it up until they get to 9. Who knows? So 40 to 49 years, you have a 1/10 of 1% is the death rate. 50 to 59, which is my age range, is 2/10 of 1% is the death rate, the case rate. 60 to 69, 1.4%. So if you're age 60 to 69, your survival rate is 98.6%. And then when we get into the older ages, 70 to 79 and 80, this is when we start to see it 6% at 70 to 79 and 18 at 80 plus years. However, if you go to the section where they talk about comorbidities, you will see that here under comorbidities, you'll see that a large percentage, number and percent of health conditions among the deaths. So of all the deaths, 85% of them had hypertension, 54% had dementia, 51% had cardiovascular diseases. So most of them had a comorbidity, right? So here, if you had 3 or more comorbidity conditions, I mean, you had a high percentage chance that you weren't going to make it, right? If you had, no severe sort of thing, then, your chances were good, which we would expect, right? Which is typical. So out of the deceased, a very, very large percentage, it looks like probably 75% at least, 70%, had 3 or more conditions. So those are the numbers, folks. right off of their own webpage. You can go check them yourself. Links will be in the description. There's some good information here. Most people aren't looking at that data, and of course they're not talking about that data either through the government updates or through the media themselves. So there you have it. If you are under 59 years of age or under, you have a 99.8% survival rate on average, it would seem. So there you go. And related to that, reported on November 17th of 2020 by Calgary CTV News, flu numbers at all-time low in Alberta. Go figure. Okay, that's it for the fact portion of the video. I'm just going to run through some quick commentators' notes on this. I just want people to ask themselves, if the Alberta healthcare professionals, the public health officer, the government, the media indeed, if they're so concerned about how we're doing in this lockdown and this pandemic and all the things that we've been subjected to in our mental health, why are they always approaching it from a perspective of fear? Why do they mention how many people have died? I've never heard Dina Henshaw, Jason Kenney, or any of the paid talking heads on the media come out and just say, hey, listen, we know things are tough, but hey, if you're between the ages of 59 and just being born, guess what? It's 99.8% survival rate. So overall, if you're healthy, you should be okay. I don't ever hear that message from any of these people because they need us in fear. They need us in fear because people that are in fear cannot think clearly and are easy to manipulate. So please look at these numbers. Please consider how much risk there actually is to the average individual in our population, and then ask yourself, is this government tyranny necessary? Thanks for listening. Take care.